Good afternoon, honorable members of Congress, esteemed colleagues, fellow public servants. Thank you very much for giving me the opportunity to address this inquiry and present the state of PhilHealth, a vital institution tasked with securing the health of every Filipino. As the leader of PhilHealth, I must acknowledge the challenges that persistently affected us as well as the progress we have made. Let me begin with a clear and candid statement. Despite areas that need significant work, PhilHealth is still a very healthy corporation at the moment. As of October 2024, PhilHealth holds a surplus of 150 billion pesos and a total reserve of 280 billion pesos, complemented by an investment fund nearing 490 billion as of November 2024. These figures clearly demonstrate that PhilHealth is financially robust, well-positioned to sustain operations, and fully capable of addressing the healthcare needs of our 115 million members. And we are steadily progressing with our objectives. In fact, we are about to implement another 50% increase in coverage for most of our case rate packages. That means that this year, we will have implemented a total of 80% increase across the board for almost all of the all case rate packages. Let me speak with candor, Your Honors. I am conscious that the PhilHealth institution has become a source of frustration for our colleagues in the government, particularly the legislators who are anxious for the well-being of your constituents. Those last 6 years before I was appointed to PhilHealth were particularly difficult, as I understand. Leadership turnover, a new CEO almost every year, created instability and delayed much-needed reforms. Operational challenges were compounded by even more issues that undermined public trust. During the last administration, PhilHealth has faced intense scrutiny and many of its shortcomings were exposed. These challenges brought us to a critical juncture, a need for comprehensive reforms at the corporation to rebuild both the institution and public confidence in it. It was in this context that I was appointed under the leadership of our beloved President, Ferdinand Marcos. The vision for Bagong Pilipinas has given a clear mandate to bring about a renewed PhilHealth, an organization that is efficient and responsive to the needs of its members. This is not just a slogan for us. It is the why and wherefore of everything we do today. Over the past 2 years, we have taken significant steps to address these long-standing issues. First, we strengthen governance mechanisms to ensure that funds are properly safeguarded and channeled where they are needed most. Second, we launched initiatives to improve benefit delivery. Third, we have embraced digitalization to streamline our processes, minimize fraud, and make services more accessible. Under my tenure as President and CEO, our introduction of new benefits and enhancements of existing ones have been unprecedented in both speed and number. We began by adjusting the existing case rates by 30% last February 14 to account for inflation. ending a 12-year managerial shortfall. This review and adjustment to the all case rates meant fairer payments for high-cost treatments, addressing inequities that burden both patients and healthcare providers. The all case rates is set to be increased yet again, as I said earlier, by another 50% before the year ends. We have enhanced the Z benefit package to include improved coverage for breast cancer. It is now up to 1.4 million from a low of 100,000. Post-kidney transplantation procedures and deceased organ donors. Hemodialysis sessions have been increased from 90 to 144 and most recently to 156 sessions, providing payments of up to 1 million pesos per patient annually to provide more comprehensive support to patients with chronic kidney disease. Rationalized case rates have been introduced for critical conditions such as bronchial asthma, bacterial sepsis of newborns, ischemic heart disease with myocardial infarction, ST elevation myocardial infarction, and severe dengue. We also enhanced packages for acute myocardial infarction, bypass surgeries, and heart procedures, alongside upcoming coverage for emergency care and optometric services. Of the top 10 high burden and mostly claimed health conditions that we have prioritized for rationalizations, we have so far completed enhancements of 7 packages with increases ranging from 1 to even more than 200%. We also released implementing guidelines for the rates adjustment of the inpatient benefits package for COVID-19. For children under 5 years old, we have rolled out outpatient therapeutic care services for severe acute malnutrition, demonstrating our commitment to holistic care. We've also included critical benefits like mental health services, select outpatient services, and expanded access to maternal and child health programs, thus ensuring care across all life stages. We have also added preventive oral health services under the Consulta program and assistive mobility devices for those requiring rehabilitation. Recently, we introduced a package for rare diseases we called Z Miracles, which is a new package for 10 rare diseases. We enhanced packages for acute myocardial infarction, bypass surgeries, and heart procedures, alongside upcoming coverage for emergency care and optometric services. Just yesterday, another set of enhancements was approved by the PhilHealth Board. Very soon, we will be able to provide coverage for emergency care, optometric services, and heart surgeries. We will also be increasing coverage for heart procedures, including bypass surgeries, to ensure that critical cardiac needs are addressed. We have also enhanced benefits for cataract surgery and lens implantation. We are also now finalizing the guidelines for the enhanced packages for acute myocardial infarction on heart attacks, peritoneal dialysis, and kidney transplants. Soon, we will publish the circulars for these packages for the benefit of our providers and members. Additionally, the removal of the single period of confinement policy ensures greater accessibility to services. All of these reforms underscore PhilHealth's utmost dedication to addressing the evolving healthcare requirements of our members. These significant benefit expansions mark a substantial stride towards our commitment to providing affordable, accessible, and quality healthcare for all Filipinos. Never before has the corporation implemented such extensive enhancements in a year. This is such a banner year for your PhilHealth, and we thank all of our fellow health advocates for bringing all of this fruition. I would like to give special mention to Honorable Speaker Martin Romualdez, who from the second day of my appointment has promised and has constantly delivered on his promise to fully support PhilHealth. Maraming salamat po, Honorable Speaker Martin Romualdez. With these enhancements, we aspire to eradicate the financial burden of healthcare costs, facilitate timely access to essential medical services, and ultimately elevate the quality of life for our valued members, the Filipino people. We also embarked on a campaign that promotes the provision of primary care services for all our members with the Konsultasyong Sulit at Tama program. The Konsulta program now provides Filipinos with covered benefits such as consultations with medical professionals, laboratory tests, and essential medications. We have accredited 2,943 Konsulta package providers this 2024, and they help us register more than 27 million members to the Konsulta program. More than 6 million of them have availed of their first encounter with their medical professionals. This measures affirm our commitment to making healthcare equitable, accessible, and sustainable for every Filipino. Beyond expanding benefits, PhilHealth remained a guardian of financial protection also. Over 50% of hospital claims are now reimbursed within 30 days on the average. This improvement reflects our dedication to make adjustments for efficiency. In the face of significant hurdles, therefore, including the absence of a national government subsidy in this year's budget, PhilHealth remains steadily on course in its mission. Our plans to continue expanding aggressively benefits in the coming year, in fact, remain unchanged. While subsidies have historically been vital to enhancing the program and strengthening the healthcare system, PhilHealth's financial health enables us to fulfill our obligations and continue providing benefits to members, both direct and indirect contributors. We do wish to manage expectations, but rest assured that for 2024, all benefits will be paid, including those for our most vulnerable members, senior citizens, indigents, persons with disabilities, rebel returnees, and other marginalized sectors. Walang dapat ikabahala ang ating mga kababayan. Sagot po kayo ng PhilHealth. What we can assure in any case is that PhilHealth management will optimize our resources and will safeguard every peso entrusted to us and make sure it is spent effectively and responsibly. While we have made progress, we acknowledge that much remains to be done. Rebuilding trust is not a one-time effort, but an ongoing process. We continue to engage stakeholders from healthcare providers to local government units to ensure that the benefits we promise are the benefits we deliver. We are proud of our milestones at PhilHealth. We also recognize that meaningful reforms require trust, collaboration, and time. PhilHealth is bound by the provisions of the law, and significant changes, including streamlined decision-making, may necessitate legislative adjustments. We are committed to transparency and accountability as we navigate these challenges, with leadership rooted in competence and a clear vision for universal healthcare. All this is to say, universal healthcare is not ours alone to make it happen. As representatives of the people, your support and collaboration are critical for PhilHealth. PhilHealth sustainability hinges not just on internal reforms, but equally important also on a shared commitment to prioritize health as a national agenda. While we are committed to continuing with the reforms we have begun, we hope to be able to rely on Congress to explore solutions, including alternative funding mechanisms that can bolster our capacity to serve the Filipino people. In closing, may I assure this august body that PhilHealth is determined to fulfill its mandate. Despite the challenge, we remain optimistic. With continuous sound management, strategic reforms, and the collective effort of all stakeholders, I believe we can build a PhilHealth that is not just renewed, but truly worthy of the trust of every Filipino. Maraming salamat po, esteemed honorable representatives.